In this review, we will focus on developing a nursing care plan for the risk of adverse reactions to iodinated contrast media. We'll cover the definition, risk factors, assessment focus, expected outcomes, and both ongoing and therapeutic nursing interventions. Let's begin. Risk for adverse reaction to iodinated contrast media refers to the potential for a negative response to iodinated contrast agents, which are commonly used in imaging studies like CT scans or angiography. These reactions can range from mild symptoms, such as nausea or itching, to severe complications like anaphylaxis or acute kidney injury. Risk factors. Several factors can increase the risk of an adverse reaction, including a history of prior allergic reactions to contrast media, asthma or other atopic conditions, impaired kidney function or pre-existing renal disease, concurrent use of nephrotoxic medications, dehydration or advanced age, high contrast media dose or repeated exposure in a short period. Assessment focus. The assessment will focus on identifying patients at risk and monitoring for signs of reaction during and after the administration of contrast media. Key areas to assess include patient history, check for previous allergic reactions, chronic conditions, or medication use. Physical exam, look for baseline respiratory status, skin integrity, and hydration levels. Laboratory data, review serum creatinine, GFR, and any recent blood work indicating kidney function. Expected outcomes. Our goals for the care plan include: the patient will remain free of severe allergic reactions during and after the procedure. Recognize personal risk factors for adverse reactions. Ask questions if new information requires clarification. Ongoing assessments. Assess for any previous adverse reaction to contrast media. Identify pre-existing disease states and current medication history that may trigger reaction to iodinated contrast media. This is essential for the safe administration of contrast media and prevention of adverse effects. Assess for history of asthma, food allergies, or other allergies which may increase likelihood of an adverse reaction. Monitor vital signs pre, intra, and post-procedure. Vital signs such as blood pressure, heart rate, and oxygen saturation can indicate early signs of an adverse reaction, including hypotension, tachycardia, or hypoxemia. Assess for early symptoms of hypersensitivity, such as itching, urticaria, or shortness of breath. Identifying mild symptoms early allows for prompt intervention before progression to severe reactions like anaphylaxis. Evaluate renal function through lab results and urine output. Iodinated contrast can cause nephrotoxicity, especially in patients with compromised kidney function. Monitoring creatinine levels and output helps detect issues early. Therapeutic interventions. Administer premedication, such as antihistamines or corticosteroids as prescribed. Premedication can reduce the risk of hypersensitivity reactions, particularly in patients with a known history of contrast allergies. Encourage hydration pre- and post-procedure. Adequate hydration helps to flush out contrast media from the kidneys, reducing the risk of nephrotoxicity. Prepare emergency equipment, such as epinephrine, oxygen, and IV access, before contrast administration. Being prepared ensures a rapid response to severe reactions, minimizing complications like anaphylactic shock. By using this structured approach, you can effectively support your patient through recovery while minimizing complications. Well, that ends this video. If you found this video helpful, don't forget to like, share, and subscribe for more nursing care plans and study tools. Until next time.